Thank you all for joining us for these core clinical concepts evaluating the role of iron deficiency and iron deficiency anemia in women's health. This is an overview of the webinars looking at the role of iron deficiency and iron deficiency anemia during pregnancy and in non-pregnant women, and how it impacts the health and well-being, and how we as clinicians can play a far more important role in the diagnosis and treatment of iron deficiency and iron deficiency anemia in our patients. In our first webinar, we looked at the high prevalence of iron deficiency and iron deficiency anemia in women, whether they're pregnant or non-pregnant, and looked at the evaluation of pregnant women and women with bleeding problems, and how iron deficiency and iron deficiency play a role in exacerbating the issues that are presented to women's healthcare providers for patients who are either pregnant or having gynecologic problems. We looked at how the OBGYN and women's healthcare providers need to take the lead in diagnosing iron deficiency and iron deficiency anemia, as well as taking the lead in initiating therapeutic interventions, whether that be oral iron treatments or whether or not IV iron plays a role in those women who don't tolerate oral iron or for whom a more rapid iron replenishment is needed because of the current state of their health and well-being. In our second webinar, we talked a little bit more of the role of iron deficiency on how iron deficiency often precedes the onset of anemia. We also discussed how iron deficiency can be diagnosed in the absence of anemia, but only if the clinician evaluates iron indices. Just doing it CBC alone is not sufficient for diagnosing iron deficiency, and it should be an important part of the evaluation of either the pregnant woman or the woman who has gynecologic issues for which she is presenting to you for care and evaluation and hopefully intervention. Oral iron is clearly an important role in a first-line approach to supplementing iron, but it unfortunately has limited clinical utility because of poor tolerability and the length of time that's needed to replenish iron stores. In those situations where oral iron is unable to provide a supplementation of iron needed to reverse the deficiency or to prevent iron deficiency anemia or treat iron deficiency anemia, we spoke about the role of intravenous iron therapies, how effective they are, how safe they are, and how they need to be a part of the therapeutic intervention when we diagnose iron deficiency and iron deficiency anemia in pregnant and non-pregnant women. In our third webinar, we spoke specifically of the intravenous iron products that are available. We were able to compare the dosing regimens, how we administer them, the safety issues, how the more current regimens, ferric carboxymaltose and ferric dirysomaltose, have a more evidence-based label that really guides the dosing of these two particular regimens. We do know that these regimens can lead to hypersensitivity reactions, and it's important for the infusion center that's providing these IV infusions to recognize and differentiate Fishbane and Carper reactions. And in fact, the pharmacists and nurse team members that are involved in that are well trained in differentiating these reactions and being able to ensure that the IV infusion is not only completed, but completed in a safe fashion. A critical aspect of this webinar was recognizing the role of anemia before surgery, on how anemia exacerbates adverse outcomes, and why anemia and iron deficiency need to be recognized and reversed prior to the initiation of the surgical intervention, whether it's to remove a fibroid or whether it's the delivery of a baby. And so we know that from a wide array of literature that intravenous iron is superior to oral iron in achieving target hemoglobin levels, and not just achieving them, but achieving them in a quicker manner. And in fact, we've been able to show that the single dose IV ferric carboxymaltose corrects preoperative anemia faster than the somewhat older iron sucrose regimens.